to get this polished video. That said, I do understand the fact that, you know, people want to have a 10-minute video now. The problem is the practical reality is that, you know, you can't, you just cannot get the fragments together correctly. You're basically trying to put a jigsaw puzzle together, and I just don't get there. Meaning I don't get there by watching 5 channels, 10-minute video. So now you've watched 3 different channels, and let's say you've watched 2 of my videos and you've watched 3 other 10-minute videos, and now you've used 50 minutes. Are you better off? The reality is I actually think that you can be worse off. And the reason that you're worse off is because the fragments, and I when I talk to clients and I talk to people and I'm trying to explain my perspective on things, is that it does, I don't like cliches, but too many chefs ruin a good soup. That is the case, right? In other words, I came here for Italian soup. Why do we have, you know, and instead we have a Mexican chef coming in to say, I want to make my Mexican soup. I'm making tortilla soup. Well, the Italian soup maker wanted to make, you know, minestrone. And now what soup do you end up eating? What soup do you end up eating? You don't, you end up eating something that, you know, you don't recommend, right? Aside from the shishi fufu, you know, highest fusion restaurant and things like that. That makes a problem. That for me makes a problem. It's my opinion, but the reality is there's a difference between I want to hear someone else's opinion and perspective, which is I'm 100% for. You can go to the newsletter, you can see it, right? I'll have my opinions. Somebody else can have another opinion. That's fine. That's 100% fine. No problem. So let's just play some of this stuff here, and then I'm gonna, you know, what is best is for me to do my work and let this play, and then for me to intervene, because the reality is once the sausage gets made, this is the crazy thing, is that once the sausage gets made, I'm that person who can't stand the way that he sounds on the answering machine, or, you know, appears on recorded video or reads the newsletter and stuff like that. I'll be so annoyed at myself due to the imperfections that I'll just feel terrible the rest of the day. So as a result, what I end up doing is I end up going, oh. So the reality is I don't end up watching most of my videos once I've hit send, or the newsletter after that. That's just like, no, because I've got, like I said, I will just detest myself too much. And, you know, I'll just find imperfections. I'll just see a long list of imperfections, and that is not great. Not great, Bob. Not great, Bob. So let's go to the video. Let's go to the library here. And what I'm going to do is I'm going to fire up one of my videos, and then I'm going to talk about it. And then what I'm going to do is I'm going to double back here this evening. I want to say, and I'm trying to, part of today, you know, it's Sunday morning, and to see what is going on, I'm going to probably restart somewhere at the 6 to 7 p.m. I'm going to send out, oh, by the way, and it's always the case. It's always the case. I've left a link there in the chat. This is the place to subscribe to Jay's Corner, which is the email newsletter, right? To give you an idea, on a 10-minute video, it takes like 7 hours, right? No, it doesn't take 7 hours. It probably takes more like 10 hours to cut it, to render it, and to post it. Is 10 hours front to back, which is like nuts. And then I don't like it. So it's really bad. Right? When you add all those up together, then all of a sudden I like want to, like, all I can see are errors. It's not a lot of fun. It really isn't. Okay, let's go to the HSA thing. Ooh, I'm going to tell you this thing. So here's for example, like this is the video, and I'm going to post it. I'm going to start sharing it in just a moment. So I posted this video on HSA, right? And literally, so I had this conversation with Bob, and Powell, been, you know, a great supporter. He's the OG. He's one of the OGs of the book, no question. That you know, what ended up happening is, let's see here, HSA Medicare, make this the big size, theater mode. Let's try to share it. There you go. I think this should work, right? Probably works. Let's see, mini player, no. Yes. All right. Okay, don't have any interest in
.com. Be sure to keep watching because I have additional comments which apply not only to people on Medicare, but also prior to Medicare for all age divisions. Thing about YouTube, which is trying to put you into silence.
gross.
The problem with that,
I really don't like watching myself in videos. It's like I wish I could have like something over my eye.
apply to multiple age divisions. I wish I had a quick fix.
I wish I had different hair.
I'm just playing by. Let's go to the interview.
Are you working past the age of 65 at a large? Maximize your Medicare. Jay, welcome. Employer may have the opportunity to contribute to an HSA, but should they?
It's a complicated question, Bob, and basically what has occurred is that the trend for working towards 65 is probably not going to stop. And
Still true.
especially many people want to continue to work beyond 65 as full retirement age under Social Security is no longer 65, but will ultimately be 67. If you work at a large employer, you do have the right to delay Part A and Part B. Frequently, people suggest to enroll in Part A.
True. So, you know, this is what I'm saying. It's like what ends up happening is that I end up, you know, I could probably like stop at a better screen than you know, this gives you an idea. It's like, oh, there's no better. That's also no better. That's what I'm saying. It's like, you know, we actually like, okay, this is as good as it's going to get, which is like insane. Anyway, the fact is that, yeah, you can delay. Should you delay? Generally speaking, if you're not on a high deductible plan, if you're not with an HSA, you just turn on Part A. The issue is that what ends up happening is that if you decide to do that beyond 65, there's the backdating issue. They're not my rules. I don't know. I actually do not know what the rationale actually would be. An attorney probably does. Some policy person probably does. I'm not a policy person. I haven't looked into it. I can backfit the HSA tax problem. That I can easily do. But basically what ends up happening here is they backdate your, so now it is what? It's the end of April. Let's say you want to turn, let's say you decide to do this, you're 67. Right. So instead, what will end up happening is your date would be set to 6 months prior. You're 67. Well, 6 months prior from May 1, right, will be December 1. Let's say you last year, 2021, you had an HSA and you contributed the maximum. You've now over contributed because your maximum was only 11/12 of the maximum, not the full maximum. So as a result, what ends up happening, that one extra month, December, that you actually, so what the IRS is doing is they're taking the maximum and the pro rata share on a month-by-month basis. So you are not receiving Part A for 11 months, you are receiving for 1 month. That means that you could put into your HSA 11/12 of the maximum. And so that by that one extra month, what ends up happening is you've over contributed. And by over contributing, that is a violation. Now, I'm going to tell you the things that some crazy stuff here that I can say live because I'm saying it live. I've heard some incredible things. Number one, I've heard companies telling people the IRS doesn't check this. You can just go ahead. All right. I've also heard the following, which is a little bit more interesting, which is to say, you could put in the amount for the couple up to the couple's maximum, and then the spouse use it. This is interesting, because this is actually, without being an accountant, an actual extra kicker here. It's an extra kicker here, and it's valuable. Because of the fact that since the monies that you contribute into an HSA lower your taxable income, the ripple effect here is back to the Affordable Care Act. So now you're 66, your spouse is 62. If you get an extra tax deduction here because you have the funds to contribute into the HSA and thereby dropping your taxable income, you therefore allow a higher tax credit under the Affordable Care Act, which is big, right? And so I'm going to be speaking in Nashville. There's something called the ACE Academy. It's the high end of net worth advisors, wealth managers. Whenever you go to a medium to large size city, and you see Billy Bob's Wealth Management type of thing, right? And we're not going to settle other matters, not in this segment of this broadcast. I'm going to get to that later, and very likely later this evening, which is that the fact is that the deduction is that the amount of tax credit on the APTC for every single dollar of lower income is pretty big. Bigger than people realize. And people say, well, I have the money so I can afford it. Yeah, that was predicated on the wealth effect of equity markets straight line as a result of the fact that every central bank has in a coordinated fashion huffed and puffed to make sure that the sales were at full attention. Well, guess what? The wind is going the other way. So what ends up happening, and you'll hear this theme, and you've seen the theme in many writings and things like that, and pretty much everything that I say is that, yeah, that's all well and good to kind of sit on your thumbs under the idea, well, everything is fine, all predicated on one particular thing. What's that? Low and stable interest rates. And oh yeah, by the way, future prospect of that going on to perpetuity. Oops. I'm telling you that this is my number one thing. That is the reason for today's timing, by the way, because I am going to be talking about this. I may have mentioned of it during my conversation with Art. I feel terrible on a personal level. I think it's because people, no. It's different if you have to use every dollar for groceries because that's the way of life that you've had. Just above there, though, is a problem. For me, just above there is going to be a problem.
With your health insurance as provided by your large employer. That said, there is a special exception, sometimes not well known, which is that you cannot have and contribute.
Okay, this is
fully up to speed. They've not yet fully adopted to this idea that persons are going to be working beyond 65. They've got a lot of responsibility, different responsibilities there. The issue is that if you contribute and exceed, if you contribute to an HSA, you penalized for that excess deposit.
Contributing to an HSA when you enroll in Part A, you can enroll in Part A up to 3 months prior to turning 65. Can you still contribute at that point to your HSA and then terminate once you turn 65, or?
Agree on a month by month. contribute into the HSA.
So nothing too much more here. I did want to intervene on this particular one because, it's the point that I could not, what ends up happening is I know, Bob and I agree that we're trying to make it into X minutes. So if I always got the question of pacing when I talk, right? I mean, I can speak at any pace, no problem. In fact, I'd probably do that. But the reality is the fact that if I tried to do that, then what'll end up happening is I'll lose somebody or some small detail will be glossed over and people won't pay attention to it. Then when I speak more slowly, then people get bored because society has such a short attention span. And I don't swear much in life, but you can attach my no, I don't swear much in public that can be reprinted. What do we got here? Yeah. Okay. Here's the point. So here's the comment portion, and this is the key. This is the problem, the challenge that Jay always has. This is the reason I started Jay's Corner away from Maximize Your Medicare. Please go and sign up to the newsletter. This is the reason right here, which is these topics, as you can hear, are, and this is why I was saying, what was it, 20 minutes ago in the rambling, which is to say that, when you try to get whatever soup you want, that's not going to work. And the reason is that you're sitting there having Italian soup, but the reality is that you needed to be thinking about the Mexican soup, tortilla soup, whatever. And because this has to do with different age divisions, you can see how dramatically, if you have planned correctly, you stayed at work to your 67 or 68. So you stayed at work to 67 to get to full retirement age, fine. You stay at 68 in order to make sure that your 62-year-old spouse has health insurance. And granted, what if you could have passed on the entire thing of this after 67? You're at your job that you don't want to, you want to retire at 67, but you can't for this extra year, 2 years, as a result of getting your 63-year-old spouse up to Medicare. If you had managed the HSA correctly and actually taken the max deduction, that in fact, what could have happened is you could have pushed down the health insurance cost for that spouse 63. This is not, male, female specific, right? Whoever the spouse is, I don't care who I rarely care about the sex of the person, of the employee or the insured versus the spouse. I will care when it comes to life insurance and to long-term care insurance, because that changes the probability and pricing. Outside of that, that's, in other words, different topic. All right, let me try to shut this and see what ends up happening. So again, I'm still experimenting, because what's going to end up happening is I'm going to start running the videos, just running in a loop, and then pop in here, because I'm trying to test to see how the quality of the broadcast actually is.
You need to have a high deductible health insurance plan. It is yours and yours forever. When you make a deposit into an HSA, you can reduce your taxable income in the year that you deposited. You can use
This is the way to think about it. That is correct. So if the crazy thing here is, like, people don't watch a 7-minute video to the 4.5-minute point. But the secret sauce here to understanding your health is health-related IRA. You get your tax deduction on the year you put it in. You don't get taxed when the money comes out. That's the way to think about it. Now you've got to meet the criteria. I put the link in that video, IRS publication 502. This is why I'm saying, so most people like pigeonhole me into Medicare because I've got this book. The candid reality is the book is there because there's 63 million possible buyers, of which, by the way, about big amounts above 50 million have no idea of how Medicare works. I'm not exaggerating. I love 50 million. So different age divisions. This all means that you're here for Medicare, let's just say. Right. So if you're 64 and you've got 2 children, you subtract out the age and that makes them 30 something. Right. They've got children who are age what? 10, 12. Guess what? Braces are here. Here. You can get them tax-free. Oh yeah, by the way, well, there's some other things that inside of that publication, IRS 502. There are 2 very, very important ones. Number 1, you can pay your Part B premium with the HSA fund money. Second, you can pay for long-term care insurance premium with HSA money. So you can see the tax shields here. Other people have kind of pointed this out. Well, they've pointed out the idea that there are these tax benefits. They haven't pointed out these specific items. Maybe some have, but like I said, I don't troll around too much on video to watch others because, like, again, I'm making Korean American soup. So I try not to find out what's in Mexican soup or Italian soup, right? I mean, I'm trying to stick to my message and hopefully that people are seeing the pieces that I'm assembling for you. In an imperfect world where the world is taking information in fragments, a method that I don't love, but then again, I can understand, well, what are you going to do? I'm going to put you on a 35-hour video.
It doesn't really matter what your age division is. In fact, I have an HSA account myself.
True. And this is key. Key not because do what I do, but key because please tell somebody else. Right? If you're Mr. and Mrs. Perfect and you're 30 and you're 30 years old, right? That extra dollar doesn't go to health insurance premium. The probability is just will not make sense. And by the way, I'm going to swerve off here. Well, you know how there was this gender thing, what was this, maybe a year ago, hashtag okay boomer, where you had millennials versus the boomers and stuff like that, and like generations doing this. I'm going to tell you this, which is that, if you're a millennial and you want to be ticked off, you should be ticked off at the 61-year-olds, the AARP. You absolutely should be. Why? Because they have sit there on a campaign saying no age tax under health insurance. Well, the reality is just think of yourself, 28-year-old self. You're 55. How many times did you go to the doctor? You're a male. Seriously. I'll tell you how many. 0. So now you're going to charge that 30-year-old $350 a month for his health insurance? You got to be kidding. The reason it's $350 a month and not the proper price of, $150 a month is because of the ratio of the Affordable Care Act of 4:1. Who put that in? AARP. There are mathematic things here, and what ends up happening is no one's fighting against the AARP.
So, one challenge with an age.
The millennials should have had their, the 30-year-olds should have their own coalition of, American Association of Millennials, and pointing out the distortions that other person, and what did AARP do? No age tax, which was completely wrong mathematically, A. B, then they distorted statistical studies to prove their point. Sunday morning, I'm like, oh, wait, top of my skull is about to
you are
pop off.
also enrolled in Medicare. That you cannot have Medicare Part A and deposit into an HSA.
True. But here it is. This is now the subject of a bill. A bill's been introduced, bipartisan, which would allow you to have Part A and to deposit into the HSA. This is pretty, well, this is more complicated than it's going to look. Okay, for the consumer, this is clear. For the consumer, this is very clear. This would be a welcome thing. It reduces the confusion. It reduces the look back period confusion, right? CPAs don't have to bring bad news to their people later going, oh, you've exceeded it, right? Because you exceeded, you can remember the example I talked about prior, which is that the December you've overpaid. True. You've exceeded it, now you don't, now you've not. Well, now the question is, that said, it is not completely clean. This is not completely clean slam dunk. Because what this will do is this is pushing more money to insurance companies. Why? Because now everyone's on Part A, right? Everyone's immediately on Part A. In which case, Part A is your primary at a small employer, right? In which case, the health insurance company doesn't have to pay. I spoke a little bit about this very deep in the weeds matter about small employer and health insurance and Medicare. And it is a place that no one's asking, Jay, on what I think about our distortions in health insurance pricing. This is one, for sure. For sure. That, again, no one's asking, Jay. But the reality is, if you have a small insurance health, small employer health insurance, and you're 66 and you're still fully employed, you can get Part B and your employer sponsored plan, but your employer sponsored plan sticker price should be no more than $300. Instead, it's $1,200, $1,500, $2,000 a month. This is simultaneously happening right now. And that money is going nowhere other than to the carrier. Nowhere. That combination should not exist. Shouldn't. Again, no one's asking Jay. But this is the case. And so when people ask me what I'm supposed to do, you're a small employer, the base case is you're out. For one reason or another, you're out of your small employer plan. The employer cannot kick you out. That's the hook. The employer cannot eject you because that would be against labor laws, which I never suggest to the employer, right? I never tell the employer, we've got employer clients, right? I never tell the employer, eject the 66-year-old. Don't hire the 66-year-old. Those are no, absolutely not, right? That's ageism, that's age discrimination, et cetera, et cetera. You think business is tough prior to you violating federal labor law. You've got another thing coming. That said, the practical reality is there's almost no chance, I'm going to talk about that when it does exist. The difference in premium paid inefficiency is five digits running per year per employee. So you're going to tell me that you couldn't find an agreement between the employer and that employee to help with what other issues need to have existed. You know the employees person by person, right? You're a small employer. That means lower than 20 that means lower than 50 FTEs according to the Affordable Care Act. You know them by name. You are not running a 100,000 person, company. You have an outfit, you'll know them by name. The employer knows you by name at some level. And there's $10,000 running per year in excess health insurance premium to the small insurance carrier. And what's the small insurance carrier telling you? They are implying that you need to have Part B. Guess what? CMS doesn't care. You roll up to the CMS and say, look, here's my health insurance. Here's telling you that I was covered from the time I was 65 to the time I was 68. Guess what? You don't have a Part B enrollment penalty. You don't. So how is it that the carrier is telling you you need to have it? Why? Because they want the extra $2,000 a month, of which they're the secondary payer, of which you could have gotten Medigap at $150 a month. And now you can understand why I'm this hot. This should not exist. That said, I can't go and tell you this should not exist. No, I'm telling you this is not the way the world should look. That said, the employer can't force the employee out. And I'm very clear to the employer, very clear, to tell them, look, you can have whatever conversation you want. That person needs to come out voluntarily, period. We're not even talking about the fact that if the person actually got sick, because now you have the out-of-pocket maximum, which is thousands of dollars worse under your small employer plan, setting your family out-of-pocket maximum at $10,000 or higher. I've seen Medicare Advantage, for example, to give you an idea, depending on your wage level, I've seen Medicare Advantage PPO as low as $2,900. $2,900 in the worst case. And Medigap, of course, you pay the premium, you pay the Part B deductible, and zero across the board, zero. Does it get more complicated for prescription? It does. It does. I'm going to tell you that one, that is true. The idea that you just gloss over it and then just go with the small employer. And now you can understand why I don't address it to this degree in the book. Someone's going to mishandle, misunderstand this small nuance. But it's not an oversight. I didn't address it intentionally because the nuance would have been misconstrued, turned. In fact, the reality is that I'm probably going to go back here at the end of this video. When I hit stop, I'm probably clipping this 60 seconds out. This isn't a pity party, but it's actually much worse than what I'm trying to explain on videos. And it's more complicated than people think it's on videos. And it's more complicated than my counterparts are trying to make it out to be on YouTube. And unfortunately, the candid reality is that the mechanics inside have to do with academics and actual science of estimation. And if you don't know how that is in fact created, this is why when I see certain explanations on YouTube, the few times that I watch these, I'm like, wait a minute. You've skipped this step over here of knowledge of, or you don't have evidence of this knowledge of the mechanics. So how did you jump over here? Because if you're wrong over here at all, your entire conclusion is wrong. Crazy. That's our world. And candidly, YouTube, I'm here on YouTube, it's YouTube's fault. YouTube's contributing to the misunderstanding of stuff, of which I don't know. No one's asking me. Yep. So there it is. This is the CNBC, the Part A. All right. I said an hour ago that I was going to just let it run, right? So instead I psychobabbled for an hour. Is there anything else to say over here? Oh. Oh yeah, this. I got fails. Yeah, you already know this. If
And
you-
out-of-pocket expenses as defined by the IRS. I don't believe in being insurance poor. Absolutely not. People have other priorities. People have to eat. So when there are tax advantage situations, when there's uses of money where the benefits per amount that you pay is very favorable or very likely in your instance to the way on how you can get the most.
Okay, so I just made the point. I just made the point about the fact that if you don't understand how complicated and what the mechanics look like in here, right? There's science, there are moving parts, they're more complicated than what is being shown to you. Instead, you skip the step and did it yourself, or you listen to somebody who didn't understand these points. Then when something gets switched around, what ends up happening? You get blindsided. The issue is that, you can see that in earlier versions of the world, what you'll see, or you'll see in articles if you go and, that what ends up happening is that because every day, what ends up happening is the information you're being told is that, oh, why you just get to roll up and choose health insurance. And then you find out the weakness over here. You have a network problem. You've got some other issue about the mechanics of the way whether or not the out-of-pocket maximum works. In which case, what you end up doing is that you've got errors. Well, the reality is that I could have eliminated the error, or you've got the wrong attitude, meaning not you've got the wrong attitude, you've ended up listening to the war story. And war story number one for health insurance is I didn't get anything from my insurance. Right? As if it were an investment. You were looking for a coupon, you weren't looking for insurance, by the way. So over here, what ended up happening is because of the fact that what insurance even is right from the jump is misunderstood and miscommunicated to you. You have a different expectation set. So over here, you're dissatisfied, thinking the health insurance company has ripped you off. The agent has ripped you off. Well, the agent may have misunderstood because they all may also not have understood what this is or stuff. Well, the complicated stuff is over here. That is the agent's problem, right? It is a problem. I'm not going to tell you it's not a problem. It is. Those 1-800 numbers on 1-800 Medicare, et cetera, without naming names. You know who they are on commercials, et cetera, et cetera. You're calling call centers, and their job is to have you cross the finish line on that call. That is their stated job. It is not for a series of calls and emails. There's a reason I communicate by email, because I want me and you to both be on the same page and have a history of that conversation. History. So that when you put down the phone, when you hit send, you can go back, what did Jay say? So you can review it and then double back and ask another question on a conversation. That is diametrically different than the conversation you're having on the call center. And the reason I swerved out of the way is because now you can understand why there's dissatisfaction, why my job is so adjustable on this matter, right? You can see how difficult it is. Why? Because you've been trained, told, YouTube, see this, see that, watch a commercial, get a snippet, sign up, it's free. Obamacare is great. Obama's the devil, that kind of stuff, whatever. And I'm not here to settle political differences. You know better. What ends up happening here is choosing health insurance not easy. Why? Because the mechanics are actually difficult, more difficult than you're told. But it's worth it. You could hear that prior 62-year-old spouse drive down the health insurance down to a couple $100 a month. Now, all of a sudden, the 68-year-old person who wanted to retire can't. That scenario is playing out today if you understood what you are doing across all of these little ingredients inside of Jay's Korean American soup. The problem is, of course, is that you're here on YouTube, you're watching a 10-minute video and you got my one ingredient, and then you got another ingredient from tortilla soup and another ingredient from minestrone soup. You don't actually have soup. You have 3 ingredients. Should get on these tirades. It's sad. It really is. It candidly is just sad, because this same, I could switch this to annuity. I could switch this to life insurance. I could switch this to portfolio construction, and I'm going to have you. All I'm going to have done is crossed off the name and just change the topic. But my theme and my principles of what I've just said over the past hour are going to be identical. Identical, I promise you. People didn't understand how the mechanics work. So as a result, they got the wrong conclusion over here. Instead, they went to go get the ingredients, and instead they didn't get the soup. They got the ingredient. And you're being sold as if you're getting the soup. Oops, I was allergic to cilantro. I shouldn't have been having any minestrone soup at all. I love minestrone soup, so it's not that. So, let's see here. Yes. So yeah, people who think that they can do it themselves. Nah. All right. That's just one 7-minute video. I've went on what, a 45 extra minutes of commentary. There's more than 100 videos here on the channel. What we do is like we have this like on auto run, everything just like pop in and make comments. It's just like, you know, it's like nuts. All right, let's just take a look at another one here. What I do like about the Zoom capacity is that I get to blur the background. So as a result, I don't have to like my, you know, this kind of thing on. Anything too interesting here? Yeah, this is Medicare questions answered. This is me and Art. Yeah, that's true. So as I've said in the past,
many people don't know this, but if you qualify for this new offer through Pink Energy, you could get paid over $2,500.
So in the background here, like I said, you know, I'm no good at video and much less at the broadcasting. So as a result, what ends up happening is you've got me being fumbleitis. Let's go back here. I think we can just go to Medicare updates. Yeah. So let's go to Art. This is me with Art. This is, you know, obviously, you know, Bob and Art in the
You ever think to
media.
yourself, you know, I could have said that slightly differently.
Oh, really?
I forgot this very important point. I'm going to add the things that I should have said, or things I could have worded just a little bit differently to make things a little bit clearer.
We're going to start this hour off talking to our old friend J.O., who has written the book Maximize Your Medicare, and is about to have another one come out, among other things. So we say good morning to Jay.
Good morning, Art. Just trying to stay out of trouble.
Yeah, I know. I don't know how you don't have enough time in your life to do what you do, but hey. So let's start with, I want to start where we started many, many moons ago with Maximize Your Medicare. What edition is that in now?
I want to call it the 9th edition. So it's the ebook is already out. The newest edition of the paperback, will be out in a week. April 19th is the date that it, you know, supply chain problems have hit also the paperback production industry as well.
So, you know, this book, it changes. This is the 9th time now. Are there a lot of changes? I mean, do the laws and rules and regulations of Medicare change that much?
Okay. I'm going to tell you actually way more than I'm answering here, right? That you've heard the last 15 minutes, right? 20 minutes. because I have a handle on how this stuff works, right? The building blocks. I've explained it to engineers. I'm not a person about health policy. That is not my academic interest. What is interesting, however, though, is I know what the Legos built to build particular structures or contraptions, right? You go to your Lego store, there's a reason you go to Legoland, right? And what do you have? You've got a bunch of building blocks. If you understand the building blocks, you can then rearrange and then therefore understand, and then also note the weakness or what can occur. And the reason I stopped this interview at this spot is for a very specific reason, which is that it's when I first started the book, what used to end up happening is that Medicare Advantage had been $150 a month at the time that Medigap was $150 a month. And oh yeah, by the way, it was HMO. That made no sense. Right? Still doesn't make sense. Right? In other words, why would I have an inferior contract, one where all the moving parts move on an annual basis versus a stable grandfathered standardized contract, which are my terminology for Medigap, which I've explained in the book. But this happened when I wrote the first edition, that did exist. And my open question in air quotes would have been, what are you doing? Why are we paying more for an inferior contract? Why? Because in any other commercial matter, financial markets, options, whatever it would be, and you don't need my degrees to know this, right? Why am I paying more for less? That's it. Right? Well, people didn't know what more or less is. Why did I say that? Well, that's what the book was to explain. The book is to explain, look, one, forget, I like my doctor, et cetera, et cetera. My doctor told me X. That's a totally different, rant that I'll have. But the fact is that what you have is that people misunderstood how they worked. Well, if you didn't understand how it worked, you couldn't understand the fact that one, you were wildly overpaying for, which was Medicare Advantage at $150 a month. There used to be Medicare Advantage at $300 a month. Like those days are gone. Why? Because the people just wised up over these 10 years with art. That's kind of the conversation we've been having. Oh yeah, by the way, macro pump Plan C, Plan F. The very first edition of the book is in there saying, Medigap has been restructured in the past. Don't be surprised. Because Medigap Plan F, Plan C paid for the Part B deductible. What did that introduce? Hypochondriosis and, oh yeah, a letter from your doctor come in from your monthly MRI. And abuse. You need to cut both of them off. And oh yeah, by the way, we've got a federal budget problem. It's an entire 6-hour live stream where I would talk about all the issues about Medicare Advantage. That's not for today. Not for today.
It's not only the price, meaning the premium, etc., but really, if we look back when we first started to
I'm going to test out the video side.
Conclusions
I'll be back.
actually quite different. Meaning, for example, when we first met, Medicare Advantage was nowhere near the market share it is today.
Owning a recruitment agency without having systems and automation is like eating spaghetti without any utensils. This is Jordan Ferrier. He made over £43,000 in 1 month, and he's on pace to do his first 6-figure month.
I'm glad I paid for the initial mentorship because I would have just been so like behind knowing what I know now.
Check out Gene Connolly. Gene started with no recruitment experience, no industry experience. We trained him up and he did an $11,000 deal as his first deal.
This program works. James, you're a maverick. A lot of you guys have the experience. You've already done deals. You've already made placements, but I've literally started never doing this before, and I'm about to make my first placement.
This is why you see Gordon Dudley. He made over $100,000 on a retainer to fill 10 positions whilst working with me in my program.
We've just started our 6th campaign. It's around 15 new clients that we have landed, and that started from the first campaign. I'm now in the process of hiring because I need more support to be able to deal with all this new business.
This is also how Zoo got 6 clients in 6 weeks.
6 new clients in 6 weeks. Also a new hiring, 1 really big account client. Yeah, I think another win is really the mindset. Because this is also the reason why I joined the program, because yeah, it's also all about the mindset.
Joachim implemented my client acquisition system to generate enough clients that brought in over 200,000 euros in 1 month.
Because it's a good position to be in where you are at the minute.
Last week I filled 4, and this week I already filled 2. Total commission is over 150K, so I think I'm in a good position for now.
We haven't really even got fully started with all of this.
Absolutely not. I'm still trying to learn. But
So if you want to find out more, we're having a free training today. So just click on the link and watch the video now. If you want to figure out how to scale your own agency to 7 figures by using systems, automation, and a virtual team, just like I did, then click the link below and watch a free training.
So Art and I never have a script. You know, the reality is that you would reject my ideas even if I gave them to him. I left out something big, which is that since the first time that I wrote Maximize Your Medicare, the #1 demographic change is that people are working beyond 65. And at the same time, the full retirement age for Social Security is no longer 65. What this has done is totally changed the timeline, the timing of applying for Medicare. It's made it much more complicated because of the way that people have had employer-sponsored plans, whether you be a small employer, large employer. Oh yeah, by the way, we've had a pandemic, we've got unemployment. Anytime any one of these switches flips from.
Yeah, so I returned and, I've looked on my phone and in fact, the broadcast works. Funny that the technology, why not a phrase of like a fly is going to come in my bed? It's like, there's no neutral place to stop the video. Okay, here we go. No, no. Oh my God. It's terrible. Let's see where we are. So what happens here is that who knows? So yeah, I skipped something big. I mean really big, which is that I should have started this with people are working beyond 65. I absolutely should have started this with people are working beyond 65 because FRA, full retirement age under Social Security, is different now. And in addition to that, what you have is that, the entire retirement trajectory is now different than it was 10 years ago. The results of that are enormous. The ripple effects are huge. And as a result, this would have changed the entirety of this part of the interview, right? I mean, you would have had a different interview. You really would have. But Art and I, we've known each other for a decade, and I owe him a debt of gratitude, one that I will not be able to repay. The fact is that what you have is a very indifferent conclusion trajectory of the book. And, you know, at this point, you know, nobody knew about the book in 2013. You know, I got an email from a person who is now comments on Reuters saying, you know, people don't want this book. I'm like, okay. I'm like, by the way, that person right now only writes about Medicare. I'm not going to name names, but that journalist now, today, still writes for Reuters, primarily about Medicare. After, when I sent him a copy of the book, this is a war story, that I sent him a copy of the book, he said to me, people are not interested, they just want to survive Medicare and then be done with it. I'm like, oh yeah, well, we'll see. And, you know, fast forward to today, and I'm still on the same, this is still my corner, right? You start retirement planning with an eye towards Medicare because it changes, well-constructed, well-planned, does fit the vital hole, not any old hole, the vital starting, the cornerstone of your retirement house. And this, you know, you cannot get around this. Is something that I knew that existed at that time. And when I met with people those days where you met face to face, that people were so far off base, so far wrong right from the beginning, I was shocked. And I said, okay, let's write these anecdotes down here to say how far wrong people actually are and have been. And this is the fundamental challenge to everybody. You know, is that smart people, educated people, and that doesn't mean being educated doesn't necessarily qualify them as smart, right? But people who know, who have experience in the way that the world works and what they've experienced, they're smart. They've survived on the planet until 64, for example. They don't know where to start. They don't know that they're supposed to ask. They don't know that where to start to ask. And this is why I spend time in public for free, which is to say, look, please tell others, because they themselves don't know that they're even supposed to ask. And from there, you can see how big the task is. I was chatting with a friend who does understand social media, different age division, younger man. And I said, yeah, my problem is the fact that people don't know that they're supposed to ask. Now, what am I supposed to do for you to discover? He's like, I don't have an answer. Yeah, me neither. So anyway, so what we've got here is me with Art. Again, let's just keep going here with Art.
Conversation, right? You know, there's a lot of reasons for that. We're not going to resolve all of those today, but then as a result, you see all of the publications, advertisements have, you know, continued unabated, and I wouldn't expect that to stop. But there's been good reason, meaning that Medicare Advantage has improved notably. Again, for a lot of moving parts involved, but that is
this little thing I was talking about.
Expect that to change anytime soon.
And it was, you know, when Medicare Advantage first came out, it was primarily an HMO, wasn't it?
No, that's exactly right.
No, it's exactly right. It's like I was going to clip out. I should say, yeah, that's exactly right. Okay. So the next 15 minutes are going to be about Medicare Advantage. We're not going to, so deep in the weeds, I think that we need to understand a couple of things. Number one is overall, so I'm going to put on my policy hat here for a few minutes. It does make reasonable sense that Medicare is trying to push money to Medicare Advantage and trying to have them manage these matters to drive down systematic healthcare costs. Because we're not going to be able to solve the healthcare system and these irrelevant comparisons to other countries. We don't have that system. It's not even for us to be diverting to the idea that, well, in Belgium, it doesn't work this way. Yeah, because why in Belgium, it doesn't work this way. We don't educate doctors in this way. We don't prepare them to get to that spot. We don't prepare nurses to get to that spot. We don't pay for health insurance. They don't pay for health insurance through their employer. Belgium doesn't have the big pharmas that are creating groundbreaking medications, of which, by the way, you only know about the successes. You don't know about the trash can where all the failures have sat. And oh yeah, by the way, they had to pay for the failures and the people. And even if it was a blank, they fired their gun and it was a blank, that still they had to. Belgium doesn't have those costs either. So the idea that we're just going to be able to click our heels and say there's no place like home and get to a solution, to a singular solution, which all of a sudden that now the United States, see it's cheapest, et cetera, see how great and superior we are. We're not getting there. Put on your practical reality hat, your only conclusion. It is absolutely that and what Dr. V points out is the issue here is I'm not trying to settle political and philosophical differences, right? That's not the way that our society works. That's my view, right? That's also its beauty. That's also its beauty, right? Which is that we have such a diverse set, 300 million Americans, which means, in a perfect world, Jay's the czar of healthcare delivery and healthcare cost planning for the country. Yeah, sure. Guess what? I'm going to make some huge stakeholders really upset. Really upset. So upset that I would not survive. One way or the other, the pressure, right? In other words, the part of, I will veer to politics today, right? Which is that, yeah, if you have a benevolent dictator and, can implement everything, and everyone has drank the Kool-Aid that I served, could I get everybody on the same page? Yeah, sure. The likelihood of me being able to do that is zero. It's zero. Right? And so as a result, the fact that we end up using these times, and I'm explaining how these things work, is to say, okay, this is the world we have as given, not because I'm trying to get to utopia, because that utopic answer, is it utopic? Not sure. I'm not striving to create a utopia that I know that we cannot attain. We just cannot. You'd have to overhaul the tax system. You'd have to overhaul the entire educational path for all healthcare providers. Go. How are you going to get all of that to happen? Oh yeah, and by the way, you can't do it in a piecemeal fashion. You've got to do them all at the same time. That cannot make sense, right? In other words, by cannot make sense, what I mean is that that's not the way that we're going to be able to make a decision. We can't agree on the city dog catcher. See, the idea that we're going to be able to create a healthcare delivery system that to say, okay, it's easy to understand, it's comprehensive, et cetera, et cetera. In order, this is this thing over here, because it's this splintered, because it's this fragmented, you want to get a solution, you've got to solve all of these little mechanics over here that these guys over here who are glossing over these topics and trying to give it to you simply. You've overlooked these other things. I just don't see us getting there. I'd rather deal with where we are today. how the world actually works. Let's continue here. Oh, man, to give you an idea on how much long, so you can understand what a problem YouTube is. And I'm here on YouTube, so I'm doing it intentionally, right? Which is that when you're getting these fragments, you're not getting the soup, right? You're getting the ingredient, you're not getting the soup. The issue here and on Medicare Advantage, and it's especially on Medicare Advantage, because you're going to see, you see slings and arrows being thrown at Medicare Advantage. And I'm not disputing that some of it's true. I'm pretty sure it is. There's too much smoke for that to be fire. There's certain activities I'm going to tell you here, and there are certain things here that I'm running unedited, because the reality is if I take the editor, I will slash it out, or I wouldn't have said it, because it'll be now a longer diversion. When you sign up for Medicare Advantage, there's this risk adjustment, right? If you're Mr. Average, you get X. That also means the government is paying like an allowance to your child, X a month. Let's say you are Mr. Sickle. Right? If that happens, the government pays you X plus Y. And let's call Y adjustment. This is a huge number. Let's say the Medicare Advantage plan has reported to Medicare, we've got one policy owner and his health situation is X plus Y. He's sick. He's Mr. Sickle. But after the fact, we manage this, we manage that, and all of a sudden the bill is a lower than X plus Y would have suggested. What ends up happening is the Medicare Advantage plan gets a bonus, can get a bonus. And this is what is an accountable care organization. That can happen. The plan gets a higher star rating, of which they get X plus Y plus Z. Right? And now you can see what had happened, that the fundamental reason here was still intact, which is that Medicare Advantage, because of the fact that they're giving X, making the carrier tell the healthcare providers, you're accepting X dot, you're accepting $100 for appointment, period. That's it. You have no choice. You don't get to jack your rates to 300. We're paying you 100. You can hope for $1,000, annual checkup. You're getting 100. That's why Medicare Advantage survives, right? Why? Because the government then using the base rate as a reference point for pricing. And if more people are Medicare Advantage, they can tighten the screws to make sure that doctors aren't charging the 1,000. I'm not here to settle whether or not 1,000 was fair value or 100 is fair value, right? Meaning, you use my educational background, my 2 schools, and you're a medical doctor. What are you looking at? You're minus $300,000 minimum, right? I'm not even talking about going out for to a football game or books or a place to live. You're not, sorry. What would you do? Just put on, again, practical reality. What do you do? I need the 1,000. Guess what? Medicare tells them you're getting 100. That's the only way to push down health. So I largely understand why more money is going into Medicare Advantage. That said, like I said, X plus Y plus Z, that system exists. This is a problem. Problem meaning that since the carriers can get X plus Y plus Z, they are motivated to drive down the healthcare cost, right? Because they're trying to get the Z, which is the bonus, the higher star rating. Those all make complete sense. The issue is that now you're the person in the middle, you're the patient, you're the policy owner, right? In which case, with those mechanics in the background, you have to, that the doctor also, there's another one, they're also getting, you know, W, which is, oh yeah, they're getting bonuses for people who are signing up to the Medicare Advantage plan. Now, you can see how complicated the web is. How complicated the web is. So now you can see, okay, well, now I've just talked about this for another 7 minutes, right? I mean, Art and I are on the actual air less than 30 minutes because of commercials, right? It's about 30, less than something like that. In which case, what you end up having is, okay, how am I going to jam in all these these talking points and have Art answer the follow-up question? Not possible. It's impossible, right? And Art is smart. He will know. He will know the follow-up question. I promise you. This is, you know, if you go and listen to his show, you know, he has actual curiosity and interest in the widest range of topics. Very excellent. That said, you can see we have a time restraint. And so now I've got to get in my points, you know, without and entertain where he's going to take us. And then within the time spot, not possible. Here it is.
And I think that, you know, one of the key takeaways to all of the messaging around Medicare that I would have for all of your listeners, viewers, is that every detail is subject to change every year. It is an annually changing contract, but that as a result of the intense competition and the improved funding into Medicare Advantage have combined to really help consumers, especially those who have you know, financial stress, distress, worries about retirement, etc. And as a result, Medicare Advantage has certainly filled a hole for those persons who want to have healthcare services, know that it's very important, yet also want to balance that with their financial needs.
And this is the key, right? Since I'm not going to settle the conversation that I've just had for the last 10 minutes, I'm not going to settle it. No one's asking Jay how to fix it. I've got a fix, actually, for Medicare Advantage, and I'm going to say it here. No risk adjustment. Period. No risk adjustment, no financial incentive to any healthcare provider, period. And any violation of anything, that's alternative one. Alternative two is if you're caught risk adjusting systematically, you're closed for business permanently. There's not a two-strike policy. There's no debate. There's no negotiation of the fine. You're closed. That's it. That's how you shut it down. You need the disincentive of X plus Y plus Z, because that money, X plus Y plus Z, by the way, that's federal budget money. Oh yeah, by the way, that we don't have. And oh yeah, by the way, whose cost of borrowing is about to go up by what? 4% a year, 3% a year, because the Fed is that far behind the interest rate and inflation curve. That seriously would be the way that I would have done it. Again, Jay's not the czar and not living in a dictatorship, right? The carriers are would hate my proposal. Hate it, not dislike it, hate it. Right? Because you can see, go on the internet, you can read risk upcoding. There are real articles, and there are real articles written by people who are either whistleblowers on lawsuits or by academics who have measured it. And that's their conclusion. It's too highly qualified to be wrong. Right? Let's not presume, this is why I always say, let's not presume the other guy in the room's dumb. Someone stuck their neck out to be a whistleblower. Multiple, by the way, multiple. And in addition to that, you've got actual academic studies, because you can set they can compare dip switches to see whether or not this has occurred. Their conclusion is it has. Excuse me, and that's why you had this headline of however billions of excess payments to Medicare Advantage carriers. Now, I'm not there to, critique the study, et cetera, et cetera. Let's just presume it's even in part true. But of which, I think it's more complicated than that. And the reason it's more complicated than that is because of the fact that, this is be real hard to prove. Real hard to prove that a company is doing it systematically. Right. The actuarial, because you're going to have error rate, and in healthcare cost, the error rate is going to be so high that you can just hide underneath that. That's what I'm doing if I'm the health insurance carrier, saying, look, yeah, but the probability of and plus we have to build in a cushion if we're wrong. So like I said, I think it's going to be hard to prove. That all said, if you did end up proving it and the carrier were violating it, very simple, you're closed. You're closed forever. Because guess what? I promise you the other carriers will, a substitute carrier will appear. We don't have withdrawals from Medicare Advantage. We have new entrants in the Medicare Advantage every year. Tampa, Florida, over 100 plans in Hillsborough County. I'm not kidding you. Over 100 Medicare Advantage plans. But X plus, so what's end up happening to the benefit of you, the policy owner, possible client, possible policy owner of Medicare Advantage, is because you don't know about X plus Y plus Z, right? That's part of these the innards, right? You don't know that X plus Y is all you're seeing competition in Hillsborough County of 100 carriers all trying to kill each other as a result of commercial competition, which is benefiting who? The buyer, the policy owner. Of course it is, right? You don't need to know what actuarial science even is, right? You don't need to know what the cost of manufacture of a lawnmower actually is. You don't need to know what the fair price is, do you? No. Amazon.com will tell you. YouTube, no, right? eBay.com will tell you. It'll tell you right quick. Because why? You'll find a price tag. You sure will. Right? And in the same way, 100 carriers in Tampa, Florida, pretty sure that they're competing away the X plus Y plus Z. And so now you can see it, right? Which is, we're going to go around and around on this competitive matter, and then to the policy owner, the Medicare beneficiary, you can see you're getting the benefit of this, that despite all of the difficulties that I've just mentioned over the last 5 minutes, the controversy, which are real, they're too credible to be unreal. Nevertheless, the policy owners paying $0 premium, $0 health deductible, $0 drug deductible, tier 1 generic at 0, insulin, now $35 a month, depending on the plan. Oh yeah, and by the way, possibly a Social Security give back option. That's the result of competitive pressure as people are getting the X plus Y plus Z. So as a result, you have some easy resolution, and this also tells you about how bad the ingredients on YouTube are. And I'm going to tell it to you now. I saw this video. There's a video out there why I would never choose Medicare Advantage. You got to be kidding. I probably should stop the broadcast right here, because this infuriates me to no end, literally to no end. There's no such thing as never. We're about to, we've got what, 10% inflation on people who live check to check. And if you're Mr. and Miss Perfect, it is 100% rational to be trying to drive your premium down to zero. And you have to accept the risk of, and then you just get PPO, in which case, even in the worst case, you've got an out-of-pocket maximum. Compare that to Medigap, where you must pay $200 a month for Medigap plus Part D, and that's a good average number nationwide. Let's call it that, $2,400. To many Americans at 65 and older, that $2,400 a month per person is food. Yet here on YouTube, you see videos saying why I would never choose Medicare Advantage. That's a person who's never met anybody who is in a situation. That's a person who's never met a person who has other priorities other than healthcare costs, other than their health care concerns. That gives you an idea on how disserving getting an ingredient one at a time actually is. It's that bad. Okay. Happy Sunday, everybody. Right? I mean, you see filtered videos from me a lot. Because of the fact that I'm trying to fit into the algorithm, right? Which I do a terrible job of, clearly, right? My channel's only 88, of which, there's a certain subset of you who have come and listened to me on the regular and, subscribed. But, again, the filtering system of the regulars is, filters. But the reality of what I've just said here applies to the entire population. These other groups that say never, a lot bigger, just pretty sad. I'm not sure. I swing between sad and infuriating, and I'm also trying to not make this a pity party. So, there's these sets of combinations of situations. Let's continue here with our tier, before.
So I'm curious about Advantage plans. Let's say you're someone, well, like me, I've got Medicare A and B and D, the prescription plan. And then I have Plan F supplement. So pretty much I'm covered. You are. Is there an Advantage plan which does exactly the same thing? It covers all deductibles, provides everything that I have with the alphabet soup that I have?
Not precisely, Art. And so there are these differences that I've, written this crazy.
So you can see out there. I like making fun of myself, actually. If you can't make fun of yourself, it's kind of hard to, throw a rock at somebody else. That's what I think. Anyway, what you have here is we're coming to the point, and the highly educated clients of ours, of which we have many. I get asked this. If we go to the chat, I'm going to start showing you some stuff in the chat. Okay. So this exists. This exists. So $0 from PPO does exist in many locations. That is true. All right, absolutely true. So in the worst case, again, if you need Dr. Magic, and can you go see Dr. Magic without a referral? The answer is yes. Are you going to be charged $0? The answer is no. Are you going to be charged a known number based on the Medicare Advantage PPO that you would have? The answer to that is also yes. You would know it. You would know it, right? I mean, the carrier would tell you what that number is. All right. It could be $50. It could be $100. But you would be covered. The answer is not you have to pay the 100%. When I say it's complicated, part of the complication here is the fact that the healthcare providers don't know, or they're wrongly in telling you this. That's a sad unfortunate fact, but true. Don't get me started on medical billing office management people, right? There's the well-meaning, and let's just presume well-meaning. There's also the persons who are trying to just only get money. So what we have here is, so we've got $0 PPO, but now when I told you that all the parts are moving, right? I've said that every detail, is subject to competition. So much so that the annual out-of-pocket maximum can be lower. Ooh, did I just end? You know, I wonder if I'm going to end. I'm not really sure, right? This is the first time I've done this kind of like live. I know there are other live platforms, et cetera, et cetera. I have no idea if people are going to be interested in watching it, et cetera. So, you know, I just decided to hit play and just as a, instead of watching Face the Nation, because there's not, you know, I don't want to relive January 6th. So let's just leave it with you there, right? So anyway, back here to Medicare Advantage talk. So we've got annual out-of-pocket maximum. In certain locations, the annual out-of-pocket maximum is lower than the Medigap premium. Right. So in other words, what you have, and that is true. Right. For example, in Miami-Dade, let's just see here what has happened. Wonder what has happened. Let's just see. Yeah, I am live. Yeah, I'm live here. Please tell me if there's so like I said, I'm terrible at this kind of thing. I'm just kind of, you know, letting it go and then, you know, just babbling. So let's just make sure. It seems that the answer is yeah. I've stopped sharing the video. It should just be me with Zoom in the corner, right? Because I want to make this point about Medicare Advantage and the out-of-pocket maximum, which is that you can read in the chat. This is how competitive it is. So for example, in Miami today, you can get to $350 a month Medigap. But can it go there? Yes. Not at 65, that's subject to competition. But over time, can you get to $350 for Medigap a month? The answer to that is yes. So that means your annual premium, right, is 12 times 350. So that math, let's get it right. So 700 plus 3,500, right? That's how I'm sure in India, a 6-year-old has understood this 10 minutes ago faster than, you know. Jay went to public school in America. That's not really gonna work. So that's $4,400 a year that you have to pay with 100% certainty. Right, you have to pay that with 100% certainty. Right, and then Part D, let's call it $30 a year. So now you get 4,200 plus 350. Yep, that's intentional here because I'm talking about it's important for people to take a look at the chat. I'm trying to talk about the chat right now, right? So I'm full screen. That's intentional, right? So let's call it 4,200 plus 360 is 4,560 a year. So now you can see what my point is. We've got Medigap, we've got Medicare Advantage where annual out-of-pocket maximum is lower than the 4560. And remember, there's some slight distortion here, right? Because of the fact that the drug out-of-pocket costs are lower than under Part D, both. So now you can understand why I've swerved. To further point out that the idea of never Medicare Advantage just doesn't make sense at all. Meaning that what you can see is that, okay, now you multiply this by 2. Married couple in Miami, $10,000 a year of premium for Mr. and Miss Perfect, who are older Mr. and Miss Perfect for sure, but still Mr. and Miss Perfect, or they just have average health. They go to the doctor, maybe they even go to the hospital once at $300 a day. That doesn't mean they're going every year. That doesn't mean they're going for the full degree. That doesn't mean they're hitting the annual out-of-pocket maximum. And now you can understand why I've gone to full screen, because you don't hear this analysis, you don't hear this conversation in any 10-minute video that I make. Because why? Because the attention span of the YouTube algorithm pushes you out. That's what happens. And this is why I'm saying, back to my idea of, you've gotten the ingredient, maybe you didn't get the soup. Right? You got some pinto bean inside of your minestrone, you didn't get the soup. You didn't. So what ends up happening is people end up saying, well, I saw in this video, or I saw in this article that Medicare Advantage is terrible, or I saw another countervailing or a different article saying, well, Medicare Advantage is like the savior. My answer is like, the reality is that we need to go and look at everything as a complete bowl of soup. Which unfortunately we've got a social media and information distribution system that does not allow this, it doesn't encourage it even. Because what ends up happening is that, to the persons with 30 million YouTube channel subscribers, that what they've done is they've learned how to use the algorithm and the way that this is searching, and so that it can be promoting it to other people with similar interests based on their watch behavior. There's a reason for J Substack, and it is not for, obviously, because of some of these details just cannot be on a video that people will watch, even if it's important. Which is all sorts of that's irrational. I understand what I'm saying may sound completely ridiculous, but that is the way that these platforms work. The book is there as a soup, right? At least it's a soup. It's a soup. The Substack, please go to it. All right, so we're almost to the end, I think. I didn't expect, actually, I would have been okay if nobody showed up. I kept talking because I just really trying to check out the technology platform and to see what could be done.
Really about
let's just
making sure that
let's
people
just see here.
have
I'm
their
turned back.
eyes wide open. I devoted a lot of time and effort in trying to explain these differences between Medicare Advantage and Medigap. There's no doubt.
I'm gonna step away for a second. I need a drink of water. I'll be right back.
A lot. Market share has improved a lot because of the intense competition. Consumers have benefited. There's no doubt about that. Premiums are lower. In most locations, you can find a Medicare Advantage plan that costs $0 a month. In addition to that, networks are notably better, which is, you've described Medigap, Medicare Supplement, Medicare Supplemental, 3 terms that mean the same. Those differences between that and the entire group of Medicare Advantage plans cannot be changed, which is your plan. Nobody can eject you. The only person that can cancel is ART, period, as long as you continue to pay premium. But the fact is, that comes at a price. And for many people, that price is too high. And especially those persons who either have financial issues or, for example, who are bulletproof, Mr. or Miss Perfect, I call them. Right. In other words, they never go to the doc. They don't have a need to. And so what ends up happening is you can, if we just make up an example and call it $150 a month for Medigap plus Part D, which is too low. I'm being conservative.
Yeah.
You're talking about $1,800, $2,000 a year. Well, Medicare Advantage now is $0 a month. Plus now, because of the intense competition, you can get PPO in addition. So now as a result, okay, I didn't say price insensitive, right? I mean, it's always about the money. We know
Of course.
that. Right. So now, so people can choose. And now, compared to when I first came out with Maximize Your Medicare, as it evolved over time, we are seeing extra benefits, etc., which again are to the benefit of the consumer. That all said, you can't get away from the inherent differences that you and I have discussed over the years. Art correctly points out that in the past, Medicare Advantage had been thought of as HMO. However, today, in most locations, the PPO market is also very, very competitive. You need to remember that a PPO means that if the provider accepts the federal Medicare card, they'll accept your Medicare Advantage plan. You need to keep in mind things that I've stated in other videos. Be sure to check them out. The annual deductible, your copays, your co-insurance, your out-of-pocket maximum can be different if you use any out-of-network provider. So if a consumer wants to save the most amount of money and lower your out-of-pocket costs, the way to do that is stay within network providers. Say that if you need to go see Dr. Magic, don't go see him. I'm not here to give you medical advice regarding which doctor to go to and which doctor to avoid, that kind of thing. All I'm saying is you need to understand the impact that they would have on your out-of-pocket costs. I do need to say the following thing, which is that, you know, sometimes I get told this is a scam or this is a trap. I see, hear, read these types of negative terms a lot. It's not a trap. It's not a scam. There are rules. There are regulations. The seller is subject to them. They have to follow them. It's also important for the buyer to understand the rules. It's important to know what the nuances are. A checkerboard looks like a chessboard. The pieces don't move the same. Why? The rules are different to what the pieces can do, how far they can move. What ends up happening? Something new, a new topic occurs, and they discard their common sense. I'm trying to make sure that people continue to use the common sense that they used to survive up to this point anyway.
What am I going to tell a farmer? So this is a real true story. So seriously, what am I going to tell a farmer who is a 70-year-old farmer about practical reality? Seriously, what am I going to tell him? He has survived 20% interest rates, weather, China, potash. The number of changes that have happened to this particular person to survive on the planet here is so complicated and so random, and so they had to pay attention to different dynamics, right? What does a big corn farmer do today? The ones with, you know, many tens of acres. You know what they do? They wake up, they turn on their computer, and they look at the CBOE, the Chicago Board Futures Exchange, to see what's happening in futures. That's what they do. How different is that, right? So this is my point that I've made multiple times, right? Which is that I don't need to tell this person about common sense. I don't. He doesn't need to know about actuary. Over this, I use his fingers. He doesn't need to know about actuarial science. He just doesn't, right? He knows already that there's randomness involved. He knows that if this particular situation, these are the outcomes, and they can be very different than the average situation. And then there's cost, et cetera, and then, okay, are they set up in the right way? That person survived to 70. So literally, what am I going to tell this person about, here's the way to think and survive on the planet? I'm going to tell them nothing. What I'm going to tell the person with the PhD in, in engineering? Nothing. What am I going to tell this person about math? Kidding me? Person's forgotten more about math since I've been on this video than I've learned in my lifetime. I'm simply trying to attach the jar to separate the signal from the noise, hijacking from Nate Silver, right? Which is you're hit with so many narratives in these fragments in getting the ingredients without the soup that it's very easy to be distracted. So we've spent how much time? We've spent over an hour, I want to say, right? We've spent over an hour on Medicare talk and health. We spoke about HSA. You can rewind this. I'm going to debate. I am not necessarily going to keep this going, meaning that not the broadcast. The broadcast, I'm actually going to not. I'm not going to broadcast this evening. In fact, now that we're all here, I'm going to just continue on to actually what I planned to talk to about later this evening, or during the early evening, late afternoon, which is financial markets, financial planning. I'm going to get to that, and we're going to get to that in the next couple of minutes, actually. But anyway, so just quickly review where we've been. I talked about the HSA. I talked about the fact that stuff moves. There's your takeaway from the HSA conversation. Even if you're not involved in HSA, the principle being that, look, the moving parts are going to move. They're going to be complicated. And we can't get away from it. So please stay up to date, right? And this is just me on my soapbox on my corner. That's why I call it Jay's corner, is because that, something's going to change, and the change is going to be fundamental. It's going to be thousands. It's not going to be, I'm not going to bother you for $15 a year. I promise you I'm not, right? You're not going to want to make changes for $15 a year. You're not. If you ask me to make the change for you to get $15, I'm going to tell you, hey, it's only $15. Do you want to change? If the answer is yes, Jay, I still want to get the $15. Guess what? I'm going to follow that direction. That's fine. Like I said, I've said many times to people directly to them, I run a 7-Eleven over here, right? You want big red gum, you get big red gum. That's fine. I have no problem with that. And we will do what we are supposed to. We will do our job, period. That's it. I'm on that. My point here is that something like this HSA, there's a new bill being introduced, and it would change a lot. It would change a lot, and it changes actually the motivation to be into the HSA. You can, if you're Mr. and Mrs. Perfect, you have every reason for high deductible health plan plus the HSA. You have a number of different reasons, bigger than people are taking advantage of, no question. I did reveal, in fact, that is my configuration, right? I've been lucky in the sense that myself, have not had serious ongoing health concerns, although, I'm older now, so that's unfortunate. Anyway, the second part was about the Medicare Advantage. Fair amount of discussion, and then also my points here on the chat, which is that Medicare Advantage is now, challenging, absolutely challenging, and despite all the news, slings and arrows, which are true. There's no question that those slings and arrows are true, that some of the controversies are earned, not just haters or lovers. This is some of the objections are real. That said, whether or not you as the policy owner really care, I can't make that decision. And for you, it's not my role here. It is my role to help you if you need guidance. That is certainly true. But not my role to determine whether or not that is enough to decide. For me, that the reason that I think it's this complicated is that those controversies, while true, may not matter to you as a practical matter. And that is the balance here, right? That is your balance here, meaning that you've got this combination of controversy plus versus practical reality. Practical reality being that this is a path where persons can save thousands of dollars if you're Mr. and Miss Perfect, or if you're Mr. Perfect and Miss Perfect. Again, not gender specific. Okay, so I'm going to go to financial markets, and I haven't. So once again, as usual, as always, actually, I've got no script, so I'm kind of flying by the seat of my pants. But I'm going to give you the following observations. I need the big banner, so I'm going to start here. This is not financial advice. Not financial advice. Securities have loss of capital, etc., and involve risk and uncertainty, etc., etc. So you can stick every last disclaimer here today. I frequently tell people, and you need to attach every disclaimer known to mankind, and you can attach it here. And I'm going to say it again. I'll say it again in about an hour. I think it probably takes about an hour. So we have given, I'm going to bring up a website. The website's going to be, let's just see, let's make sure that we can get there correctly. Let's just go over here. Okay. Oops, that wasn't it. Real simple stuff, real simple. So I'm going to just start here. Yeah, I'm going to start here. Let's just make sure that we're sharing this correctly. I'm not. This is the problem. It's one of the problems with Zoom. Here it is. So this is investing.com, right? It's free. I ignore this narrative. You can see in the Substack on the newsletter, I'm very frequently making fun of the fact that this has almost nothing to do with anything. It has something to do with something because other people are reading it. It doesn't necessarily mean anything that this has anything to do with what's actually going on. But anyway, you can see over here, I am not looking at the Dow. So 101, I am not looking at the Dow. The Dow is 30 companies, their prices divided by 30. So if we have 29 unimportant line items and one important line item, it gives them all equal importance, which cannot be possible. This is a fake number. Far more diversified is S&P 500. That's the US 500. Okay, so what's going to happen here is I'm going to bring up the graph, and here it is today, and we'll bring up other graphs. This is, as you can see, let's just use 5 hour because it's going to give us a couple of days, I think. Let's use even 1 hour. On Friday morning, I wrote to a person, I have my stealth crash helmet on. I have my stealth on Friday morning, right at the open. So by background, my first job after graduate school in financial markets, in the fixed income market on derivatives, bond options, the housing crisis, asset-backed securities, what was it, the Big Short, et cetera, et cetera. I could explain it ad nauseum to you. No problem. All right. I wrote an email yesterday. The reason I don't really talk about it is most of the audience doesn't know what a central bank is. So would not know the significance of the fact that I've spoken in front of central banks. Just not relevant. Other than the fact that this is not my first exercise in complicated matters. What did not concern me was necessarily this, which is Friday right here. This line here is basically Friday. What concerned me was Thursday. That I did not like at all what happened around here on Thursday. And it was not because of the actual direction. Okay. And here's, I'm going to be saying things and sentences, and the problem with financial matters is that, or the challenge of financial matters is, it's very difficult to assign the correct weighting to a particular principle correctly. Very difficult. But what happened on Thursday is actually showed for me what would almost certainly happen on Friday. Okay, or most likely to happen on Friday. And I'm going to show you more examples of that, I'm not the only person to look at it in this way. I promise you that. I'm not smart enough to invent the method. I'm simply kind of retranslating the method and trying to explain it in a way that everyday people can understand it. On Thursday, we had this very sharp decline at the end of the day, and my problem was not that, but like I said, for me and something, my financial planning clients know this. I'm not looking at one item, one specific fact in isolation. I find a singular financial fact, whether it be S&P 500, whether it be your healthcare cost planning element, whether that be your 401k, it does not matter. A single element in isolation is almost irrelevant. I care about combinations. It is not one item that can hurt you. It is combinations of items that can hurt you, always. If I post a 5-minute video on YouTube, you've already shut off, right? Which tells you how bad information distribution actually is. Anyway, here we go. It is not, so this was the overnight. And then we just immediately presumed, I found this highly probable. And I found it highly probable due to Thursday. Because during here under Thursday, what did we also see? What I also saw was, and of course, I'm looking at the bond market, and here you saw it here. So the graph will switch shortly. So here it is. Come on, you. So the graph will switch to the long bond, and actually it should really just be the 10-year. So over here, I've switched, you can see I've switched this to bonds up here on the top. I've switched to bonds. And now you can see the 10-year, and now here's the 10-year bond yields. So bond prices for beginners, for newbies, bond prices move in the opposite direction to interest rates. What I saw here was almost no change. And the reason for the pregnant pause, the reason for the silence and slowing down of the talking here is intention. Should turn on some Game of Thrones music in the background here. It wasn't stocks in isolation that was the issue. Because, right, you could have program trading and somebody hit the sell button. That can happen, right? Again, not one fact in isolation. My problem is the fact of lack of panic here. The problem with the setup here now is much worse, actually, than January and February. It's worse. It's not better, it's worse. And this was my concern going into Friday, which is nobody bought the bond on Thursday. I'm like, what are people doing? And I'm sitting here watching it, so like I'm listening. So you can, you may think that you don't want to be mean. You'd be right, but the fact is that on Thursday I'm watching. Thursday, and especially at the end this afternoon, I'm like, it's weak. The stocks are weak. Stocks are weak. And what I also found is that no one was selling stocks in order to buy bonds. And this is the problem, is that we don't have panic yet. So, right, because otherwise, if you have panic, I would have most likely, not certainly, most likely, I would have saw bond yield, this number, drop. Because why? The normal process would have been sell bonds, sell stocks, buy bonds. That didn't happen. This is the problem with portfolios now. It's the problem with portfolios. It's the problem with individual items, both. And that, because both occurred Friday, that made Friday probable. And again, probable. I didn't say 100% certainly. I said probable. And this is actually what it ended up playing out. And the issue here, now that we're here on Sunday, 10 a.m., your problem isn't Face the people like This Morning, or I think my mother likes This Morning or Face the Nation or something. Anyway, Sunday talk shows, instead you're here with me. This exists now going into Monday. We still had no buying of the 10-year. How is that possible when stocks were down 3% on a day and finished at the low? We still have no panic buying for a safe haven of the US 10-year. What we do have, and extra complications here, is you'll see this. So people of the Substack, if you go to the chat, please, if you're new here and are not enrolled and not subscribed to the free or paid versions of the Substack, you should absolutely be there on the Substack, because I realize that the comments that I'm making are not really in the mainstream media. I realize that, I'm trying to build rationale so that you are not blindsided when something changes, which it inevitably will throughout your life, irrespective of age division. The reality is that I should be promoting or trying to reach the millennials in your life a lot more aggressively, because the fact is that they don't have the scars and the biases that are implanted wrongly on you, right? Unfortunately, the reason I have to repeat myself this many times on different matters is to help you unlearn the distortions which you've been hit with for decades. But anyway, here we go. Right, I understand that Twitter gets all the news because Elon Musk. Sure, that is fine. High profile person. Twitter doesn't matter, like at all. Zero. In the global landscape, more dollar versus euro foreign exchange transactions on foreign exchange desks trade before 5 a.m. than how many Twitters? It's not even close. I tell a person, an individual stock is like the flea on the tail of a dog. It's just simply irrelevant. What you do have here though is, so what the only evidence you have is back to here, selling of stocks, not diverting to bonds, but just into dollars. Euro over dollar means that this minus means that the dollar is stronger. So someone sold stocks and not bought bonds, they just bought dollar cash. You add all of that up and you'll see what has gone on here. Let's just make sure that the sharing is right. Sometimes the sharing of Zoom is not good. So let's go to people on the Substack. You've seen this. You've absolutely seen this, right? Which is that, this is BlackRock. So there's a specific reason I use BlackRock, right? This is top of class, world's largest money manager, world's largest, right? No one's going to debate their ability to create this model, to create this targeted index fund, targeted retirement fund. And 2040, I used it as a number because it's 20 years from now. Otherwise, we're going to do what? I'm going to look at 6 or 7 of them. No, you don't have the attention span for my explanation on 1. How am I going to explain 7? Year to date, 10% minus. Got all sorts of ripple effects. We'll leave that commentary till later. Okay. And you'll see, in addition to that, if we go to competitors, I'm going to get to my next spot. Vanguard targeted fund. I had on the Substack a longer version about the lawsuit about Vanguard, but that doesn't remove it from its prominence in the spot in the world of this world. It's telling you about diversified portfolios, and that's my point. Is when people are making these diversified portfolios, they're using one particular twist on one particular model, which I've described in another video, which is on the Substack. The name is Sacré Bleu. Okay, and of course, if you speak French, you hate me right now because my accent is completely fabricated. Here we go. Price and performance. They not very conveniently hit it. Year to date, minus 10.3. So you got BlackRock at minus 10. You've got Vanguard at minus 10.3. All right. This is the smart guy in the room. 2 of them. Your takeaways are what? Number 1, the idea that, minus 10 is this. If you're a minus 10, you've done as well as the smartest guys in the room. Yeah. Right. That doesn't mean that these models that create these portfolios are perfect, right? Because they are ultimately models. That all said, it also tells you the degree of how close. Somebody says to me, okay, well, I've outperformed by 1% compared to this. I tell you, you've hit a double or a triple. In other words, you've done very well. Why? How do you know this? Because the difference here is 0.3% amongst the smartest guys in the room. That's how close this is. It also tells you that the idea that I'm making this up about Sacré Bleu and the curve and Henri and my explanation, the idea that I invented it out of thin air, it's not possible. It's not possible. If you ask a person who knows what linear algebra actually is, they'll also know that it's not possible. How rough it's been. Okay. Right around here. And you can see the challenge, which is what I've been saying is stocks for show, bonds for dough, that the bond market actually, and as I've said, again, the stuff that I've said, I'm kind of regurgitating. Maybe you find it a broken record. Maybe. You can see it here. And you can do this for yourself, by the way. You know, I'm not saying, I'm just showing you how I'm looking at it, compare so that I can see, keep your, you know, eyes on the ball. So you can see here, this is the S&P 500 in SPY form. There it is. And oh yeah, by the way, the market continued to go down after hours. You can see it there. So there it is. This is bonds and stocks year to date. And yesterday or Friday's version of the newsletter had this through Thursday's close, and you can see what happened on Friday, no better. And still, what did you have? You had stocks straight down and still no diversion back into bonds. This is evidence to me that we don't have panic yet. We don't have the appropriate amount of panic yet. So the idea that we're at the bottom, I find to be very, very low probability. The flip side of that is that that means that the highest probability path is continued down. That can, right? That's why I meant this spot. Which happened to be Sherlock Holmes. You know, I never read Sherlock Holmes, but anyway, that, you know, you eliminate what isn't, what drops out, even if seemingly illogical, must be the only conclusion. And that, by that method, that means these numbers down here are about to have, you can see it here, awfully close. Now within spitting distance, just 2% lower. Does this mean you adjust? This is rough, right? Again, because you could not, I need to reinsert, not financial advice, right? If you're there to be able to be sensitive enough and quick enough, is this still a spot to adjust? Yeah, you could, you know. And oh yeah, by the way, you need to think to yourself, we're going to get to the financial planning element probably at the bottom of the hour. I'm going to probably end this at 11, largely because my throat is sore. I don't actually like to talk, but you know, that I probably should have done doing something different than having a YouTube channel. Anyway, we are no better than August of last year, right? But at any rate, you can see it here that you can believe or not in technical analysis, and it doesn't matter what you believe or what I believe. What I'm certain of is that others are looking at it, and those others have lots of money. That's all you need to know, right? I mean, and again, this is back to practical reality. You think your neighborhood is like wildly overpriced, but if the richest guy in the neighborhood buys the biggest house in your neighborhood at 20% over the asking price, guess what? The price of the houses is too low. The entire house neighborhood's going to get repriced, right? Everyone knows this. Everyone knows this. Yet when we change the topic, we have the same dynamic. They use a different logic, which is like crazy, right? It's the same logic. Here, you can think that I don't believe in technical analysis or looking at these as if they're random lines. I'm here to report to you, other guys with truckloads of money are looking at these lines. Guess what? You at least need to understand what they're looking at. And I'm saying you can see very clearly here. Earlier this year, 2 visits of this spot. What's the logical probabilistic path? We're going to visit that spot. I would assign it. Is it 100%? It can never be 100%. It can never be 100%. Is it high probability? Pretty high. That's 2% lower. What does that mean? That means that this number is very likely to read minus 12 at some point, unless what? Unless some of the money has gone into the bond market. Then a lower 2% in stocks can mean a less than lower than 2% drop here, because that means bonds have gone up. Right, and this is the allocation exercise that actually happens in the professional market. Right, which is that, the smartest, biggest guys in the room, that's the best that they could do. Right, if they had some way to plug in the model that they knew was going to save or make and beat each other, right? They're trying to compete one with the other, they would have done it. That's the best they got. Everything is telling you, in other words, everywhere you look here, you get the same. Let's just see here. Shut us up. The most likely next spot is here. And it can come quick. You could see it here, minus 3% the other day, Friday. Minus 3 from here is lower than that spot. Once you get to that spot, guess what? Now everybody's going to be start to look real carefully at each other. Real careful. Because the reality is, you're going to look on, if you go and click around right now, or at 11 o'clock when I end this broadcast, I'm going to end at 11. You're going to click around. You're going to see on the financial press. I'm not alone here. When I said not 100% certainty, that when everyone is looking at this spot, which I promise you everyone is, or lots of people are, that's reason that when the boat has too many passengers on one side of it, it's probably wrong. Right? That's why I don't say it's 100%. That fact alone. But my point here is that why on Thursday, why this past 20 minutes? On Thursday during the day, I didn't see the appropriate amount of panic. And instead I saw these funds just continue to plow straight down in lockstep with the stock market. Meaning that I know that they're not 100% the stock market. I've already worked backwards, right? I've already reported on the Substack that it's 60-40, pretty much right on the dot. 60% stocks, 40% bonds. I worked backwards for the math for you to basically look under the hood of what's inside these funds, right? It goes back to over here. Remember, I was telling you an hour ago, I was using a different topic about Medicare Advantage, right? I was using a different topic. What was the topic? The topic was, since I know what the ingredients look like and how they are priced, I could come up with some thought about what's going on over here. In the same method, because I on the videos I showed you about the glue and the hurricane forecasting and et cetera, those elements, we've now changed to, I don't know, pasta dishes, and now we have Chinese pasta and we've got Italian pasta, right? And both of them claiming credit for inventing it. But anyway, today's not a cooking channel. Please don't change the cooking line. These elements of the ingredients on portfolio construction, right, had to be true. There is no other way getting you to this conclusion, right? And in that same way, I've just deconstructed that for you in other elements of the Substack. So you followed until now, My observation on Thursday was this thing continued to go down. Why? How did that happen? How did we get from here down to here and nobody bought bonds? Nobody reallocated the bonds. How is this possible? And by the way, if you could say, Jay, you don't have the full information, that would be correct, right? Because I'm going to tell you something even worse, which is if you're telling me that the bond market, that the allocation did occur and it still went down by that amount, now I've got some really bad news for you. Because that means that's setting up for way lower. That you have to open up the likelihood that the door has swung a little bit wider, but it's nowhere close to how wide it could swing. Which means that if bonds have continued to sell off at the time that, so let's say you were here. I realize what I just said doesn't make sense or can be confusing to some. Let's say you're here. Okay, where the crosshairs are. And at that point in time, you've seen what would have happened is people seen stocks go down. They go, okay, forget stocks. I didn't buy this whole up thing, which I was a complete disbeliever. But let's say that it went up to this point. Today's not financial advice. The stocks started to go down. No one bought bonds. If you're saying that actually people did buy bonds, but still the overall market continued lower, that means that one of these two elements, either stocks or bonds, has much lower possible. Because if that means all the people who, if the big funds, big by big, I'm not talking about, your brokerage account broker. That's not a fund, big fund. Sorry, right? If you're saying that the big national pension funds have already allocated to bonds and the bond market has continued to drop, what happens when interest rates go higher? And that bid is now been exhausted. Now you're talking about way lower on this pink line. What would that do? Way lower here because it's 40% in the pink line. There's a reason that today's live broadcast is today, right? Because this is a very, very, very bad setup. This is a very bad setup. Every time I turn Rubik's Cube on what are the possible combinations, not one, combinations of elements that has created this year to date and where we are here on this, there aren't lots of good narratives to be out of this in the very short run. There aren't a lot of defensible explanations to flip this graph, these graphs upside down, right? We need to think, so you can see how complicated it is in even writing the Substack. And I'm going to, right, because on one hand, I'm showing you this graph, right? I've shown you these graphs relative, and I'm showing you about real market dynamics and the way that the actual portfolios are built. I've shown you this. I've shown you this on the Substack where I'm talking about, this funny curve the meme stocks, whether you're involved, they're having to do with the concept of the glue on what's underneath the hood of portfolios. The flip side is, and yet I need to balance that with this, graph here, which is this idea that, hey, you know what? My narrative can be wrong. And that we must understand that this thing can always be the flip side around. In this instance here, the reason that I'm using today as the very specific timing of today's broadcast, but I haven't broadcast live, I don't know, something like 2 years, 2.5 years, is if you're in the, and it goes to show you how like the media and some of the stuff that you see in the media is just wrong. It's just wrong. You're not over here. You're not. You're always here. Always. No matter what your time frame is, you're at the arrow. And now what I'm saying is that this curve, which we normally thought of as symmetric, the bell curve, you could fold it in half perfectly. They would collapse on each other and be symmetric in shape. Because of the fact that I've shown you this setup over here, that in fact, for the very short run, the curve does not look symmetric to me at all. At all. That +1 unit minus 3 units is not a good setup. It's a very bad one. Very bad. So in the absence of a crystal ball, right? I mean, now you can understand the balance, because basically what I'm saying is, yeah, normally I'm considering us 50-50 on a diversified portfolio. In certain spots, it stops being 50-50. And then now you'll understand it's 10:30. I'm going to get to your financial plan. You're 31 years old. You're a professional. You've graduated from law school. You've got your CPA, your medical doctor. You're a professional. You have a high paying, you're skilled labor, right? You're a machine tool engineer, etc. You probably want this. Meaning that I'm 31 years old. I want to plunge. I don't want down. I want minus 30% down. Because I need a better entry point. I do. Absolutely. Right? I don't want to pay 24 cents for a nickel. I'd rather pay 14 cents for a nickel. Right? There's always a distortion between the nickel and the actual market price, right? There's always a distortion. Right? I'm 31 years old. That's exactly what I want. I need a better entry spot so that I can reset the price at that red arrow at a lower price. That's it. The end. Very clear. Right? So this is why I'm saying about the financial planning, right? It's not the combination of this, but now we've just changed it to, we don't care about a single fact, we care about combinations of facts. And now I've just changed topic, right? I've talked about stocks versus bond in the very, very short run. And the reason I was going to have this right around the 6 o'clock areas, because we're going to get our first look at where the market will be on Monday at 6 o'clock today, PM Eastern time, right? That's when those on investing.com, the future market's open. Not that you could do anything about it unless you have an overnight account, right? You can't execute it. But when we see minus another 1.5% overnight, or we're going to probably see a revisit towards that double bottom we saw. We'll probably see it overnight. That's what the highly probable path would be. back to financial planning here because it was beyond 10:30. If you're a 31-year-old, you wanted this. Why? So you can increase your allocation into the risky asset class at a lower price point, period. That's it. The end. Okay. You don't want it so low that, of course, that you lose your job. That's different, right? This is also why you don't buy your company. You don't keep plowing your money into your company stock. You're already on that boat. Why are you loading all your other worldly possessions onto the same boat? Why don't you put that on shore? You don't like the double down by putting extra of your worldly possessions, your family heirloom on the same boat. You're already on the boat. Don't continue to buy your stock. Don't be ridiculous. Anyway, now you can see the price over here. We're here. You want lower. You're 31. You're 64. You're 71. This is entirely different. Way different. You're 60 with an eye to retirement. If you've been under the wrong idea, oh, well, in the long run that stocks are up. This graph this graph and this narrative here needs to be taken away. You need to keep this in mind. There's a reason for a second book, and here it is. Part of the main misunderstanding of financial markets is this. The entire narrative: in the long run, stocks are higher. In the long run, we are all dead. Is the flip side, right? The long run is the sum of short runs. In other words, I can build the counter equally and more correct. And oh yeah, by the way, don't ask, if you ask a physicist whether this is correct, they won't even, they don't need this red lettering stuff. They say, oh, it's based on this. This is correct, period. There will not be a debate. And if you know a physicist, you'll understand they'll be pretty adamant because they know that they're the smartest guy in the room because they are, right? And they know it, by the way. But anyway, so now a physicist knows this. Everybody with an engineering degrees knows this and has seen this lattice. All of them. Your medical doctor, they know that this construct exists. How they then change the logic used because it's financial stuff is nuts. I've had this conversation with my mother, which is that people use one set of logic that you've used your entire profession and academic background and everything you know from a common sense point of view. And then you change the topic to finance and you throw away the entirety of your logic and then create some other narrative because it's in Kiplinger's. Now you understand why I'm in this tirade. Now you understand why I said I'm talking about Farmer Fred. What was I going to explain to him about the fact he knows that this is the way that the world works? Stuff happens, right? Jimmy, inflation runs Paul Volcker, and guess what? There's 20% inflation. I don't remember the time, but I see it in a history book, and I know that the 70-year-old farmer was alive during that and survived it. Of course it can happen. The issue here is that, okay, now you're 74, now you're 60. You think you're down here, and in the long run, we're going to return to the mean. Nope, you're just back to here to the red, to the part of the red arrow. And you've started over from here, which is, oh yeah, by the way, at the beginning of the year, you had 100 units, right? And now, guess what? You're at 90 units. And now you had some projection about how you're going to have retirement savings and then how you're going to liquidate those retirement savings in an orderly fashion. Your base point is no longer 100. That was 4 months ago. Your base is now 90. Right? And oh yeah, by the way, to get up to 100, you just get to go up by 10% in order to get up to 100? No, 10% of 90 is 99. You're still -1, right, compared to January 1. And oh yeah, by the way, let's say you had to use one because a Martian stole your roof, and let's say it cost you 2 units, right? So now it's 88. And now it went up by 10%. Now you're at 96.8. 3.2 units lower than 100. Right? Everybody follow? Right? This is the issue. Within the long run, this is our average return. These are the distortions here that exist out here when you're being given summary statistics to tell you about your financial status or other types of narratives coming from Joe Stockpicker. Because it runs contrary to math and science, and science of estimation. And so now, and now you can understand why I'm this fired up, right? And why I actually agreed to this very bad idea of writing a second book. Don't write books, but it's not good. Anyway, the fact is that this distortion here of the fact that you are actually here and the point in time of your financial planning cycle, timing of where you are, income generation, life, career choice, other protections, and then orderly liquidation. You can understand why we started this part with what I saw from financial markets observations, and it's leaked now into this other topic. Again, this is about combinations, not single individual items. Right? Because now all of a sudden you're at 90. The best of class is at 90 in that area. If you had 100% of your savings into the market, even if with the best of class, at best you're at 90. At best. And by the way, the people who are like, oh, well, I'm going to buy PayPal and Peloton and, the high flyers because it's great. And I want, I like taking victory laps in front of my friends. You're not at 90, you're at 60. For that part of the allocation of the pie. So as a result, what has ended up happening is you're down here staring straight into the face what I said at between 10 and 10:30. And now, in fact, you're very likely, the highest probability is you're going to be at 88. And the ripple effect goes on and on depending on your basis of time. So obviously you can, not obviously, but now perhaps you can understand why I chose today. Why I chose today and why I was thinking about somewhere around the 6 o'clock time frame. But then then I wanted to see how this would work. And, in fact, it does work. Zoom does work, and, blurred out the backgrounds. I didn't have to clean it up and all that kind of stuff. And on we were able to go. And I'm also able to project these screens. And I don't want to do the editing because editing literally is that's the rabbit hole you just don't get out. And it takes a full business day from the time I hit stop to the time that a 10-minute video comes up onto YouTube. It's the full business day in order to even prepare. Right? We don't have a full business day. It'll be Monday by that time. And oh yeah, by the way, the most probable path would have already occurred. Do I have anything else here? Yes, I do. the link here then, and that this will, we've got important stuff here that, you know, my mother says to me on the other day, you know, in a previous conversation, she had listened to some interview, and she asked some, you don't know my mother, but you know, I didn't know, I didn't need to be told that a woman could be president someday. You know, I was raised by that. But you know, she's that smart. But anyway, my point is everything to you really very important. It's like you like overuse this phrase. I'm like, okay. Anyway, let's see here. Yeah, there is something that I'm trying to show you here. I'm wondering where it is. I think we've lost it. Okay, so we're gonna go back to videos here because I want to show you these types of items, and this, when it comes back to financial planning and your financial, you know, setup, your overall setup. Financial planning is kind of like, you know, then it's just these different combinations, right? Because one item, what ends up happening is on YouTube, everywhere you look, you're being told about one particular topic in isolation, one ingredient, of which my point to you is that it's still not the thing. That's not, it doesn't mean blow it off. It just means that it's still one ingredient of the soup. And you still need to have the right soup, right? And that is also the complication, right? Because reality is the oregano specialist is has their own motivation to distract you from the soup. Why? Because you may have less oregano for basil or thyme, T-H-Y-M-E, or rosemary, right? They don't want you to substitute for oregano. They want you to keep buying oregano. That's their walk of life. They're an oregano farmer. And if someone has a snappier way of, you know, kind of describing this balance, you know, making up a more clever analogy, a more creative and, you know, clear analogy, let me know. I'd be all interested. But let's just stick with minestrone soup in the absence of that. And the reason I bring this point up, and this will be the closing point. This will be the closing point, but it's actually the punchline here. And this is what I'm going to be speaking about in Nashville. Right? In Nashville, I'm going to be speaking in front of the high-end, you know, something called ACE Academy. Right? And this is going to be, you know, quote unquote, the high end of wealth managers. It's something I said, you know, a couple of hours ago. This is bad. Well, what am I looking for here? I'm trying to find the video these videos that I'm trying to show you. And what am I doing? Operator error, clearly. We clearly have operator error. My point here is what's sitting here in Jay's corner. What's sitting here on Jay's corner, the channel. You can see what I've done, and it's terrible. Terrible is the wrong word. It is the result of the fact that since I understand that you're being fed oregano and thyme and rosemary and basil independently, that what I've done is moved all of the ingredients that is not Medicare to Jay's Corner YouTube channel. Okay. That is what has happened. That is what will continue to happen. It's an unfortunate set of facts because it should have been people find me on Medicare, realize that there are other topics, naturally gravitate towards them. That's not the way that YouTube pushes out videos to the watching public. That's, by the way, it's not only YouTube. So, Facebook is collecting your data. TikTok is massively collecting your data, right? But what you have over here instead is, you can see it here. We've got the other, you've got me talking about other elements, other ingredients in piecemeal fashion. And to give you an idea how bad it is, how unfortunate it is, right? Which is that we'll see it here. You know, not supposed to be this way. All right. So that what you actually see here is that if we look at watch list, blah, 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 I don't care about any of this, no. Yeah, if we take a look at this list here, you can see these different topics. The issue is no one's listening to me when this thing keeps, when the Fed keeps blowing wind behind the sail and we're straight up in stocks because everyone's taking victory laps. Whether they should be or not is, I mean, we have results-oriented society, so be it. What actually happened and what I'm finding and what I will certainly continue to find today, what I will certainly continue to find is that in fact, what ended up happening is that those same persons who are like, who actually weren't getting what they should have gotten, also glossed over these topics over here, which were the other ingredients inside the soup. Whose value said, well, I've got the money because I've got 100 units in my stock portfolios, in my retirement saving portfolios. Well, now you got 90. And now you're older and now you can't get access or the price has moved on these other elements. And oh yeah, by the way, I actually didn't need minestrone soup because, you know, I wanted to have, you know, tortilla soup was really my soup. I didn't do it. Why? Because I was glossed over it as a result of a Fed-induced portfolio performance, which, by the way, you were led to believe was the result of the fact that oregano was the secret ingredient. When in fact, the entire time, the oregano farmer was taking credit for this, which happened to, after the fact, work out, but wasn't formulated with acknowledgement of this process. None of those show up until now. When now, instead, we flip the returns, right? We've not had a negative bond market to this degree since it's been recorded, since it's been kept track of. Not once. Over 50 years, right? That's how bad. We've flipped this around and now all of a sudden the taking false credit, which is the fool by randomness. Readers of the Substack know this. I call it the second best business book. It's actually the first best business book. Anyway, the second best business book is newly available for publication on Amazon.com, by the way, as of April 19th, the paperback. Anyway, the fact is that this was overlooked from the jump people blew it off from the jump. Why? Because they bought the false narrative of the oregano farmer who took false, wrongly formulated credit, also fed by a media narrative that says stocks are up in the long run. Yeah, okay. Again, that depends on your time frame. Isn't consistent with the physicists who are the actual smartest guys in the room. And now the weaknesses appear. Because as soon as it goes in reverse, what does end up happening? All the topics that were disregarded and thought of at, because guess what? The oregano farmers during this period, what have they been saying? They've been saying this playlist should be ignored. That's all I got today, everyone. Have a good Sunday. What was it, 11? I know today's long, the reality is that it's just too complicated to talk in 10-minute segments. Unfortunately, social media, YouTube, and that is the way. And I can't get the boat to go back ashore. No way. Right? YouTube's already won, and video has already won. Facebook is trying to, and everyone's trying to have the broadcast on video. I get it. But that leaves you in an uncomfortable spot with having to try to say, okay, is this actually helping in my soup? By the way, I'm going to be running a contest. You can have it here. I'm trying to figure out what to give you. The giveaway is I need you to title the book. The next book. It's like chicken soup for your financial plan. I'm not sure Mr. Canfield would appreciate that. All right, everybody, have a good day. Thank you.